All right, let's go straight to today's discussion. And today's discussion is we want to look at fibroids. We're going to start it today, maybe finish it tomorrow. We'll look at fibroids and pregnancy. This is the silent growth that changes your fertility story. Oh boy. I know you've heard a lot of things on social media or even on the internet. You search it, fibroid, a lot of things are there. And sometimes you don't even have clarity for those things you are reading. But as usual, we will try to make it as simple as possible for everybody, regardless of who you are. Whether you've gone to school or not, at least you should understand. Yeah, it's not only for, well, of course, we'll remove all those big grammar and all those medical jargon so that you can understand, right? A woman can go for routine scan. I'm not going to shout today because my testosterone level is low, right? So just catch me like that. So I was saying that the woman can go for routine scan, and all of a sudden they begin to hear things like multiple uterine fibroid. See, what does that mean, right? Of course, when you hear that, there is that instant panic that comes, right? Because several questions begin to race through your mind. Of course, I've heard these questions over the years anyway. Right, you hear things like, can I still get pregnant? Will I lose the pregnancy for those who are pregnant? Do fibroid always cause infertility? Must they be removed? Those kind of questions, those kind of concerns. These are the kind of things that people want to know, that they get to ask when they are diagnosed with having fibroid. And of course, you know that, of course, smart people quickly go online, right? More likely, the online information will worsen your situation for you. Because there are two extremes in the information you get online. Yeah. Some people will be told that fibroids are harmless. Some others will hear things like, you may never carry a baby with fibroid. But nobody's giving you details, right? You see, fibroids are not simple. They are not simple. Yeah, some of them you can have them, and they may cause almost no reproductive problems, right? Because some people will say that, oh, I had fibroid 10 years ago. I've had all my kids, and Yes, that can happen. Right? Then there are others that may have some significant interference with their fertility or even their pregnancy because of the presence of fibroid. Right? So tonight we're going to open this fibroid matter layer by layer. Right? We're going to find out what they are. We'll find out why they grow. How they affect your pregnancy, and why the location matters more than the fear you are fearing, right? All right, so if you are ready, please tap on your screen, share the live. In 1 minute, I'll be back.
But they hold on tight, love close at hand. It's a joy and a storm, it's hope and it's pain, tears in the sunshine, love in the rain. Every scan's a story, old souls and new. I'm just the witness in the heartbeat blues.
All right. How did this music change? Okay, I think it will stay there now.
Every journey begins with hope.
All right. So if you're here and you're ready, please talk to me in the comment section. Just type ready.
This
All right.
is fertility.
So let's begin from
This is
what fibroids actually are. I think that's a good place to start, right? What are fibroids actually? So I'll just try to simplify it so that everybody can understand it. You see, fibroids are non-cancerous growths, right? Non-cancerous growth that arise from the muscular wall of your uterus. Now, if you have been following day by day, listening to the things I say, what I just said now will be easy for you to understand, because the other day I was talking about the 3 layers of the uterus, and I'll talk about the muscular wall, the endometrium, and the outer wall. So by now you already know these things, so it's not going to be difficult to catch, right? So fibroids, they are non-cancerous, so do not be afraid. Calm down, right? Calm down. They are non-cancerous growths that arise from the muscular wall of the uterus. That's where they are coming out from, right? And what they are really, they are actually made up of largely of smooth muscle tissue. Don't worry about smooth muscle tissue. You are just muscle tissue, right? Then that muscle tissue mixed with what we call connective tissue. So all that put together, that ball of tissue, is what fibroid is. And what is important really is, unfortunately, fibroids are extremely common. That is why it's important you know about it. Dr. Jody is here. Good evening, you're welcome. Welcome in. So they are extremely common, and it's even becoming more common as the day goes by, especially with respect to the kind of things people do these days, right? So I said all that to say that many people have fibroids without even realizing they do, right? So calm down. Why do fibroids develop? So tonight we're going to be slow, steady, but very, very detailed. Good evening, Rock. Rock is here. You're welcome. So why do fibroids develop in the first place? Right? I'm going to disappoint you because the exact cause of fibroid is not completely understood. Exactly what is causing this thing, right? But fibroids are influenced tremendously by estrogen, especially progesterone, and of course genetic factor. Well, of course, you know that by now it's more common among black women than the other people, right? So these are the 3 things that influence it greatly, right? In fact, I think somebody asked a question, was it last year or so? And the simplest way I told the person was that when the uterine wall is influenced by estrogen over a very long period of time without reproductive activity, it begins to produce its own thing. Why? Because the uterus is produced for something. And what is the job of the uterus? To carry baby, right? Okay, Rock said, I know someone who has fibroids. with low progesterone. Okay. Low progesterone as at what time in the journey, right? So this is the thing. This is the thing. When you do your tests, hormonal tests especially, it's just a snapshot of what is at the time you are testing, not the full play of how the activity of the hormones has been across the years or across the months. Is that okay? So this snapshot gives us an idea of what's really going on at the time. So yes, the person may have low progesterone, but again, you don't know what has been happening. Especially early bloomers. Early bloomers are more likely to. Usually, when I examine people, I say, when did you attend puberty? Usually, they're always early bloomers, right? Why? Because their uterus has been exposed to estrogen and all these hormones for a longer time, and now they are 30-something years old and still refuse to produce a baby. Oh boy. Anyway, so yes, Rock, that can happen, but again, it's not a complete idea. Is that okay?
Every heartbeat tells a story.
Yes, I hope you understand what I said already. So let's go back to the gist. So I said all that to remind you that fibroids are strongly influenced by estrogen, progesterone, and of course genetic factor, right? And it's more common among Black women than the other people, right? Oh boy. Now this is why fibroids often grow, because all the things I just said are the reasons, right? They grow during reproductive years because of these hormonal influences. Of course, if you have a potential for fibroid, the hormonal influence, of course, definitely would exacerbate the potential. I don't speak English. You said I study English. Anyway, so yeah, so fibroid grow during reproductive years, right? It also changes during pregnancy. Yeah. Why? Because the same way your body will care, nourish, and grow a baby is the same way it's considering a fibroid. Why? Because it supplies enough blood supply, rich in nutrients, right? So that's why it just grows when you're pregnant, right? What can you do to reduce estrogen? Go and see your gynae now. Faithful, see your gynae, right? But you can check my videos on the YouTube channel, Dr. Gordon EMB. Search estrogen. I've done an episode on that. I'm sure those information will help you. Is that okay? So the fibroid will change, of course, when it changes during pregnancy, and interestingly, they shrink after menopause. Why? For obvious reasons. Look at the things that influence it to grow. So when those things are out of the way during menopause, what happens? They are starved and they shrink, right? And of course, I know that there are people who are taking some what do you call that thing now? Some maybe herbs, some kind of drug to shrink fibroid. And Rock said no blood supply. Yeah, no sufficient blood supply and hormonal influence. That's the reason why they shrink during menopause, right? And I was saying that, of course, there are people, they are selling to you some drugs, some herbs, and all that to shrink it. Well, whether or not that works, I don't know. But again, I've not seen somebody who I can confidently say I've examined and it worked for. Why? Because anything you would do to affect the size of fibroid, you are doing to your entire reproductive system, including your hormones. So you want to be careful what you're taking. Is that okay? All right. So That is the reason why it is what it is. This glitz is here. You're welcome. But again, understand that. Thank you very much, this glitz. I appreciate you. Seriously, thank you. Good evening. You're welcome. Understand again that not all fibroids behave the same, right? So fibroids have tribes, right? So what tribe is your fibroid? Right? So do not be apprehensive. That's why I'm trying to water down how serious it is, right? Do not be apprehensive. The moment you have knowledge now, you're going to face your journey more accurately with confidence and proper solution. Is that okay? So Rock said Igbo tribe. Sub-Zeros, alright, we'll get there. Is that okay? I think we'll talk about maybe tomorrow, because this gist is not one day gist. It's so important that I need to spread it across days. After today, you see, the uterus is a lovely organ, and I don't want you to be a contributing factor to causing your infertility. So let's look at the gist, right? So this is actually more important to know that not all fibroids behave the same. Leon is here. Hello, Leon. Good to see you. So when it comes to fertility and pregnancy, right, location matters more than the size alone. That's why when people come here and say, oh, I've been trying to conceive for 2 years, they said I have fibroid and blah, 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 blah. The question I always ask is, what is the size and what is the location? Right? Because location is key. It's key. So who is ready to dissect just a little portion of it? Then tomorrow we'll do more justice. Who is ready? Talk to me in the comment section. Just clock it. Right? If you are ready to dissect this thing, let's clock it. So we're going to look at major types. We're going to look at major types. Is that okay? And I will start with just basic idea to help you understand what's going on. We'll start with the one they call submucosal fibroid. Don't worry about the name, I'll tell you what it is. And now this one I'm starting. Thank you very much, Rock. The reason why I'm starting with submucosal fibroid is because this is the most fertility disruptive fibroid. Right? It's very annoying. This one grows towards the uterine cavity, where the baby is supposed to be. That is where that one wants to be. Very annoying. All your mates are growing somewhere else, but you want to be where enjoyment is. Right? So that's why it's very annoying. And the reason why it matters to know this is because they distort the implantation space. It's concern. It's a thing of concern, because if they are there, the whole thing we've said about implantation in the days past, it would not be possible, because now fibroid is occupying where implantation is supposed to occur. And of course, there is no implantation on a fibroid because it does not have the integrity to receive implantation or carry a baby, right? So that's the first thing. It distorts the implantation space. It also interferes with the endometrial development. Normally, you know that your endometrium every month will develop shed. Now, when there is fibroid in situ, it disrupts the development of that space. Of course, I hope you know that I'll talk about that. So it affects with the endometrial development and also disrupts embryo attachment. So yes, fertilization did take place, but where am I going to implant? So it's going to disrupt the ability for the embryo to attach, then implant. Do you understand what I'm saying? And unfortunately, even the submucosal fibroids, don't worry about the name, just submucosa means the one that grow inside the cavity, right? So even those that are relatively small, they can reduce the implantation rate. So those ones are small but mighty, right? Reason why sometimes they do hysteroscopy, not just to look for scarring, right? They look for polyps, small growths, and even small fibroids. In some of those cases, they take it out. Do you understand? It's very important to know these things, so that you know, if those that are prayer warriors, you know what to pray about. You want to cast and bind some mucosal fibroid. You cast and bind it. Because it's not only reducing the implantation rate, it's also increasing miscarriage rates. In this case, implantation did take place, but you have your embryo and fibroid competing for space and nourishment, right? Because they directly will alter the environment where pregnancy begins. That's why they are very annoying, very notorious, and they are very concerning, right? Rock said, but the sister-in-law took in with that kind of fibroid every full time. Yeah, okay, I'll need to see the report, because remember, location and size is the key, right? Location and size is the key. So until we get that information, we may not run with that with your comment, right? So the next type is the one that is called intramural fibroids. These ones, they grow in the muscular wall. Remember the muscular wall? If you were not here when I was talking about that, sorry, go and check my YouTube channel. I talked about the uterus. Now it's going to premiere tonight on YouTube. So 10 p.m. Nigerian time. Go to YouTube, search my name. The video on uterus will be playing there. So you want to check it out, so that you understand what we are saying now. Right? So the intramural fibroid, these ones, they grow in the muscle wall, right? Within the muscle wall. And the effect of this one is dependent on the size, right? Depending on the size, also depend on the number of this one, and whether they distort the uterine cavity or not. Because even within the uterine wall, they may grow big enough to distort the uterine cavity, and that in itself is a problem. Anything that distorts the uterine cavity is a problem, right? It is a problem. Yeah. So large intramural fibroids may affect blood flow. You have pregnancy or wherever you are in your cycle, right? Now, they alter uterine contractions, right, and reduce the efficiency of implantation. That is how they behave. That is how they behave, right? So that one is, all this is intramural fibroid. Then there is a third one, the subserosal fibroid. Don't worry about the big names, right? Focus on the concept. so that you don't get carried away. The subserosal fibroids, these ones are the ones that you find outside the uterus. Is that okay? They grow outside. They grow outward. They don't grow inward to distort anything. They just grow outward. And they often affect fertility the least. Hardly would you... Most people that you hear that they had fibroid, they carry their baby, they've given birth to all their children, usually if you check is this one, subserosal fibroid, because they're outside, they don't disturb anything. The only time they will cause any problem will be based on their size and the discomfort it does to the woman, not necessarily how it affects the baby. Is that okay? So they often would not affect fertility much, right? What they do is just to cause pressure symptoms. You feel heavy, you know. Why? Because they're just causing confusion in your abdomen, not that they're affecting your fertility. Where they become much of a problem is where they're extremely large. And at such size, they may not significantly interfere with implantation anyway. But again, extremely large will mean that they're occupying too much space. Remember, the uterus, when you are pregnant, continues to expand. Now you have an extremely large fibroid, and your baby will be competing for space to grow. Right? If you go to my blog, right? If you go to my blog, there's an article there on fibroid, of a fibroid that weighs 2 times larger than the baby. So more like a twin. The baby came with a twin, which is a fibroid, right? And if you have not checked my blog, oh boy, so much information there. I'm not talking about the YouTube channel, I'm talking about my blog, right? You want to check it out. Let me see if I can write it here. Let me see if I can write it here. No, I ain't writing anybody. Let me just put something here on that blog. So if you have time, you can go and knock yourself out there. Just search on your Google search.
Every journey begins with hope.
Dot. Where there is dot, I'll put comma so that TikTok will not be angry.
This is fertility.
Blogspot.com.
This is life.
Yeah, that's my blog. Where there is comma, just change it to dot. It will take you there. So much information there, especially this fibroid one, and of course so many abnormal pregnancy situations you will see there. Some will scare you, some will educate you, right? So if you love reading, go to the blog, you'll see a lot. Okay, so I was saying that, I said all that to say that unless the subserosal fibroid is extremely large, they may not significantly interfere with implantation. So that is the idea. Now, as usual, we must give you the details so that you don't leave here more confused, right? Let's look at how fibroids affect fertility, as an addition to the things we've said already, right? How fibroid affects. In these few minutes, we're going to look at mechanisms. Yeah, you go no book. So long as you are following me, you will know book. So if you don't want no book, shift. When I say no book now, I'm not talking about. Don't forget about the grammar. Just understand concepts. That's what life is. There's nothing that is difficult.
Every heartbeat tells a story.
The only reason they try to make it difficult is so that they can distinguish between those who went to school and those who did not go to school, right? So nothing is difficult. If you like feel like things that nothing is difficult because you can know anything, right? So this one, so long as you are following me, you go no book. Your people will say, wait till where you go. So let's look at how fibroids. Let's add more information on that. We look at the mechanisms, right, on how fibroid affect fertility, right? Because fibroid can actually, thank you for the Go Popular Tislet. Fibroid can interfere with pregnancy through multiple pathways simultaneously. So if you have fibroid, you want to hold your phone closely like this and be learning. Right? So the first mechanism I want to talk about is the distortion. UD is here. We never finish with fibroid. You don't talk of the surgery. Come on. Calm down. So let's first understand this thing, how it behaves. Then we can now consider the surgery and if there are effects. Is that okay? Because if we just jump into it, will confuse people more. And I know Sabi confuse people, right? So either you know it or you don't know it. Is that okay? So thank you very much for the hearts, me. Lovely is here. You're welcome. Good evening, you are welcome. So the first mechanism I want to look at is the distortion of the uterine cavity, because that is one of the chief way fibroid would affect fertility. Is that okay? We are living legend. Living legend, are you here? I don't know yet. So now understand that the embryo, what is an embryo? You already know that when sperm and egg meets, that thing that is formed is an embryo, right? The embryo needs space, right? Living legend is here. Good evening, the Marvin 2026. I see you. You're welcome. Thank you for the rose. Living legend. Right? So the embryo needs space. Of course it needs space. No sharing, right? The embryo needs space. It needs blood supply. It also will need what we talked about yesterday, the receptive lining of the uterine wall, right? So if fibroid distorts the uterine cavity, implantation becomes more difficult. So if you have been diagnosed with fibroid, these are the kind of information you need to know how it affects you, right? Don't just run away and say, oh, I have fibroid, therefore my own don't finish. No, your own never finish. Right? So it distorts the uterine cavity, right? It distorts blood supply and also will distort the receptive lining. Remember, based on their size and location. Don't forget that part of the gist. Right, so that's the first mechanism. The second mechanism is what I mentioned quickly just now, is it will reduce blood flow. Why? Because as it's expanding, it's either compressing or occluding blood supply to the uterus. And I told you yesterday that the supply of blood to that area is so rich. That is why when some people go to do foolish things like aborting with a quack, they get to bleed until they pass away, because the blood supply is so rich, right? And fibroid can alter that whole uterine circulation, as rich as it is. Darlington, I see you. You're welcome. So fibroid can alter that whole uterine circulation and even the endometrial vascular development. Remember, as the uterus, the inner part is building up, expecting pregnancy, there are blood supply, that area is becoming rich in blood supply. So even fibroid will distort that one. Then you see why it's actually a problem to fertility, right? It will reduce the implantation support, and therefore either the implantation does not happen, or there will be miscarriage. Good evening, Ivy is here. Hello, Ivy. So that is the second mechanism by which it affects your fertility. It will reduce blood flow, right? If you understood anything up to this point, just clock it in the comment section. Let me be sure some people are learning. If you are not learning, you go. You cannot talk. you will learn in the hard way there, right? Thank you for the follow. I'll follow you back as soon as possible, right? So yeah, Marvin is here, right? So the third mechanism by which fibroid affects your fertility is it causes abnormal uterine contractions. Living legend, you are just coming. Okay, the simplest answer to that, we really do not know the specific reasons, right? We don't know the specific reasons, but we know the things that can influence it, right? She's asking of the cause of fibroid. So with the specific reasons, it is not well understood yet, but the things that influence it is genetic. And we know that Black people are more prone to fibroid because of genetic reasons. Hormonal influence like estrogen and progesterone over time, right? And I said from my own personal experience, I know that early bloomers are more like early bloomers who have refused to have babies, right? are more likely to have fibroid faster than late bloomers. That's what I've said. Thank you very much. Thank you, Yudi, for the rules. Right. All right. So the third mechanism by which this happened, I said you're going to be having abnormal uterine contractions, right? Because the uterus is a muscle. I already did all that. Go and check the YouTube channel. Search on my profile, uterus. By the way, it's premiering tonight on YouTube. So 10 o'clock, just go there. You see it. It will be playing live there. So you want to check it out. So the uterus is a muscular organ. Yeah, it's a muscle. Beautiful muscle, right? But again, fibroid or fibroids can actually disrupt the normal contraction pattern, whether you know it or not. Whether you know it or not, the uterus is in a constant state of gentle contractions, right? Then when it's time for the menstrual period, it increases its contractions to squeeze out and clean out itself of menstrual blood, right? So that is the reason why it has to do all that. So for people who may have maybe some issues with painful menstruation and all, or maybe even miscarriage, the contraction is still playing a role, right? Marvin says subserosal, intramural, which measures. We'll come back to that. Ask me when I finish. I will answer you. Is that Maybe by then I would have answered your question before we get there. So fibroid can disrupt the normal contraction pattern of the uterus, right? If fibroid is present, depending on the size and location, do you know it can disrupt sperm transportation? The same way, oh boy, this thing is so interconnected that you cannot, and I beg people, take care of your health. Take care of your health. Because if you play with one aspect of your health, other aspects will suffer. That's just the truth. Now, even the gentle contraction of the uterus is also helping sperm to propagate forward. Right? Now fibroid is disrupting it. Right? So it's not only disrupting the contractions, it's also going to be disrupting the transport of sperm.
This is fertility.
Right? Where sperm is supposed to be traveling in a high freeway.
This is life.
If you get to a point, it's beginning to see Mountain Everest in front of it. How are we going to surmount this mountain? Right? Right. Now, if for some reason the sperm was able to navigate itself across the uterus and the disruption is causing, the fibroid and the disruption is causing, right? And it meets the egg, fertilization takes place. Now another problem. The embryo will have to come and implant. And where will it implant? Where fibroid is disrupting. Is anybody understanding anything I'm saying? Talk to me. If you're understanding anything, just clock it in the comment section for me, right? Are you understanding anything? Oh boy. The fourth mechanism is inflammation. You know, some fibroids create local inflammatory change. What does that mean? It can create in a certain area of your uterus, can cause inflammation to occur in that area. That's what we mean by local, right? Not local international sense. Right? So some fibroids can create that kind of inflammation. Right? And also that kind of inflammation will now alter the uterine signal. We already know what signals they are. Right? And when this happens, the ability for the uterus to receive, that is receptivity of the uterine lining for embryo, will be affected. You see why fibroid is so notorious, right? Now it's affecting receptivity, and also it's going to affect the stability of implantation. Hence, you're going to have issues with miscarriage risk, right? So go back and examine what is going on in your uterus. Is that okay? Somebody's just waiting for me to finish because she has a question. And the question is, can you get pregnant with fibroids? I think it was who was asking that question. Is Rock mentioned something in that direction, right? With respect to the person she was referring to. Can you get pregnant with fibroids? Many people do, yes. Many people. But it is critical for you to understand, right? It's critical for you to understand that fibroid do not automatically means infertility, no. And that's why we're having this discussion, so that you don't now use your emotions and your mindset to affect yourself, thinking that it's fibroid that is the problem, right? Fibroid do not automatically mean infertility, no, because many pregnancy will occur successfully even in the presence of multiple fibroids. How do they say? Some women here will say fine boy, right? So even in the face of multiple fine boys, right? So there are those who have been pregnant with multiple fibroids. There are those who have been pregnant with large fibroids. That's why I gave you my blog link. So go and check out that. You see, the fibroid is 2 times larger than the baby, but yet the baby survived. Right? Now, the thing is, the real issue here is the type of fibroid, the location of the fibroid, the degree at which the fibroid has distorted the uterine cavity and the overall function of the uterus. That is the real issue. It's not that they said there's fibroid, oh, your own don't finish. No. The real issue is, what is the type? What is the location? To what degree is this fibroid distorting your uterine cavity and uterine function? Do you understand anything I'm saying tonight? Who is understanding something? Talk to me. Just clock it in the comment section. Right?
Every heartbeat tells a story.
Right?
This is fertility.
Yeah, you're welcome. Thank you. Thank you for understanding. So, what happens to fibroid during pregnancy? You know, I mentioned that in a passing earlier. So, what happens during pregnancy? What happens? If you're just joining, you're welcome. If you have not followed me, you want to follow me now. And if you are trying to conceive, make sure you go and download the book, The Preconception Blueprint. Only for people that are ready to conceive. If you are not ready to conceive, and you are not ready to do what I say you should do, you go give me my book back. So what happened to fibroid during pregnancy? I hope you know that during pregnancy, hormones changes the uterine environment significantly. Right? What's going on? Because you have estrogen and progesterone. They will begin to rise as you are pregnant. They rise. So the rising level of these hormones will also impact the growth pattern of the fibroid. So some fibroid will enlarge, right? But not all fibroid will enlarge. Some will remain stable. Right? Some will remain stable. Then some of them will grow bigger than the blood that is supplying them. You know, have you ever been in a place where you grow bigger than your salary, right? So there's some fibroid that grow bigger than the amount of blood supply they receive. So there's a way we describe those kind of things. But don't worry. But I just want to mention that so that you know the funny things that happen. So when this kind of enlargement happens, right? The ones that grow bigger than the blood supply, they definitely will degenerate. Why? Because for a tissue to survive, you need blood supply. So when there is no blood supply, what happens? There's going to be degeneration, necrosis, right? And this degeneration can actually cause severe pain You know, there are those, they have a fibroid and they're feeling pain. Yeah, this decision can cause severe pain, even inflammation, and even local tenderness and all those kind of things. Don't worry, a doctor will help you manage it. So that's what happens during pregnancy, right? There are also potential pregnancy complications that are associated with fibroid, right? Because not every pregnancy, right? Not every pregnancy with fibroid becomes complicated, no. But the risk can increase depending on the case. So there are those who are pregnant that have fibroid, they can end up in complication. But remember, I've said earlier that there are those who may not even, they will have all the kids they needed to have, and with the fibroid, and nothing happens, right? But with respect to these ones, there is the possible issue that can occur, like you have pain, right? Bleeding, the risk of miscarriage for obvious reasons, right? And now this one, very interesting, placental position problem. So I'll not go into the details, but just know that can happen. Then for those that have maybe large fibroid or multiple fibroid that is occupying a lot of space, there's the issue of preterm labor. Time never reach, but pikin won't come outside. Why wouldn't it come out? The fibroids are occupying all the space. They are parasites. They occupy all the space. But the one that gets my attention the most is, normally it's expected that when you're close to term in pregnancy, the baby will be head down, right? But with presence of fibroid, there is that possibility of malpresentation of the baby, right? Malpresentation because of the fibroid has distorted the whole space. So how the baby is positioned now will be a function of the available space. So it can cause presentation, and ultimately it may lead to decisions like cesarean section and all that. Like the one I was mentioning in my blog. For those who were not here, ambaneg.blogspot.com is the name of the blog. You want to check it out. That one was delivered through cesarean section. Tall, slim Lily is here. Long time, good to see you. You're welcome. Right? So that one was actually delivered through cesarean section, because you will see the baby bump of that woman as though she was carrying quadruplets. But when the CS was done and stuff like that, the baby came out. I think the baby was like 2 kg or something. But the fibroid was like 4 point something kg, 2 times bigger than the baby. So fibroid was the landlord, the baby was the tenant, right? But anyway, the complications and any other thing that can happen during pregnancy, the severity will depend heavily on the location of the fibroid and the size of the fibroid. Underline that part. Location of the fibroid and size of the fibroid, right? Yes, tall, slim Lily, I'm doing fine. Thank you very much. Thank you. Many people hear words like fibroid and immediately they'll just assume pregnancy is impossible. No, that's why we're talking about it. So don't get into that frenzy, right? Because it will create unnecessary panic. Because we all understand the reality. I'm just trying to help you understand what's going on, right? Some fibroid will require intervention, Others may just simply require monitoring, right? So do not approach it with fear. Just know what's up with you, how it applies to you, right? So when you get evaluated, you look at the results, you know where you're at. If you need intervention, your doctor will tell you, with this type of fibroid, you need intervention. Some people, not necessarily intervention, you just need to be monitored so that you don't end up in complications. Therefore, others, you don't even know it's there. There's no symptom, right? Now, to the question that Yudi, is Yudi, are you still here? If you have gone, hi. So the question that Yudi was asking, right? But I want to start with this question because it has to be fundamental before I answer your question. Let's deal with the fundamental question. Do fibroids always need surgery? That's the first thing we need to know before we jump to your question. How is it that Yudi is not here? Oh boy, that is I don't know what to say. This is your question and you're missing it. Anyway, do fibroids always need surgery? The answer is no. Not always, right? The treatment with respect to fibroid will depend on these four things, right? Will depend on symptoms, will depend on your fertility goals, will depend on the fibroid location, will depend on your pregnancy history. So that is the basis of the treatment, right? Because some people conceive naturally without any intervention, right? Like somebody will say, my case is different, right? So some can go ahead without any intervention. Others may benefit from myomectomy, that is fibroid removal, which a lot of people have benefited from, right? If there's fibroid causing infertility, take it out. Then go ahead and have your babies. Is that okay? Especially if the fibroid is distorting the uterine cavity, right? If it's causing recurrent implantation failure, right? And if the miscarriage that you've been having is linked to the fibroid that is present, go ahead and take it out. That is what is necessary. That is the basis for the intervention. Not just because you have one fibroid that was mentioned, you're just 2 centimeters somewhere. They say, oh, you need surgery, and you're rushing to the theater. I don't know what you're doing. You need understanding, right? You need some understanding. So, long story short, fibroids are not they're not necessarily harmful lumps, right? And it's not an automatic destroyer of your fertility. No. Understand what we've talked about today. Fibroids are hormone what do you call it now? English. Fibroids are hormone responsive structural changes, right? And these structural changes can alter the uterine function depending on their biological behavior and their location. Simple as that. No biggie, right? No biggie. But remember again, your fertility is not only dependent on the uterus. There are several other things, right? So, but the fibroid in the uterus is a question of what is doing to the environment for implantation. right? So pregnancy is not just about fertilization. It's not just about implantation, right? There's also the part of blood flow that is necessary. How the uterine cavity is, the space, the hormonal coordination. And fibroid can influence all these things. Yeah? So get evaluated, right? So if you've been diagnosed with fibroid, don't panic immediately. Why? Because I'm here for you, right? Don't panic immediately. Don't ignore them anyway, blindly either, because it's very important you take those information seriously. But you want to ask the questions. Where are the fibroids located? These are intelligent questions you ask that will be beneficial to you. So you have fibroid, yes, where are they located? Are they distorting the uterine cavity? In other words, is it going to distort where the baby would be, right? Are they affecting implantation, or are they going to be causing bleeding, right? Do they come with symptoms? Gladys Love, I see you. You're welcome. The reason I said all that is because when you understand the specific behavior of the fibroid that is troubling you, right, it matters more than the diagnosis alone. Once you understand how it's, where is it, where is the size, is it causing me symptoms or not, bam, then you are good to go to face your journey. If you are just joining, you're welcome. If you have not followed me, you want to follow me now. So fibroids are one of the clearest example of how the structure of the uterus will affect fertility. So the uterus is not just a tissue, it's actually an architecture. I tell you, the uterus is a beautiful organ that you should. Now, what would you pay bride price for? So it's not just a tissue. You're looking at blood supply around that area, hormonal responses of the same uterus, even implantation environment. These are all the things that are considered with fertility. Right? Pregnancy is still possible, depending on what and where the fibroid is occupying. Right? All right. So if you have a question, you still have a question after everything I've said, please send your request. Come and ask question so that I can help you today. And even tomorrow we're still talking about fibroid, but for today, let's help you with the question you have. Is that okay? Send your request, come up. But did you understand? Anybody here? Did you understand anything I just said? If you are just joining, I know you don't understand anything. Just go to the YouTube channel and catch up, right? But those that were here, do you understand anything? Do you understand anything?